to the slides for the epidemiological report. So I'm going to ask those slides to be put up and to roll to the second and then the third slide. So the epidemiological situation remains as seen. The epi curve showing the months from July all the way through to the current month of November in different colors: light blue for July, purple for August, dark blue for September, green for October, and orange for November. That curve shows that while we did have a downward trend throughout the months of September and October, the end of October into the start of November saw what we keep referring to as a plateau, and that plateau is best demonstrated by the dotted line that runs throughout the graph that got to a flat sort of direction or disposition around the start of November. And as we have moved forward, as we have opened up and started to interact a little more, we have seen an increase in the numbers of cases, even taking away the cases that would have arisen within that prison system cluster. So we do want to take the opportunity at the outset, from the get-go, to remind persons, all of us as collectives and as individuals, that we need to continue to adhere to the guidelines for reducing risk of transmission via our interactions. Let's move to the next slide. The next slide basically shows us the age and sex distribution for the cases. Next, please. And that age and sex distribution for the cases basically stands as it has in the past, with a slight preponderance of males. You'd see that preponderance, that increase in favor of males, is now a little larger, and that's largely because of the number of individuals that have been tested positive within the prison system. So whereas we were seeing 52 to 48, that sort of ratio, now we're seeing 54 to 46 just about, but it's largely being driven by a large number of men testing positive right now through that prison system cluster. The age groups remain as they have in the past, with the 25 to 49 age group being the majority, and the under 25s being the minority, if not the minority, but being the smaller of the groupings. The 60-plus age group, while it is not the largest age group among the cases, does, however, contribute to the largest grouping among the fatalities, as you will see in the next slide. So in the next slide, we see that the distribution of men to women among the deaths is quite different, where we have basically 75 to 25, 75% males to 25% females, with the over 60 age group accounting for nearly 2/3 of the deaths. Now, while we do note that the deaths have occurred in the over 60, the elderly age group more often, we do want to re-emphasize that we have had fatalities in the younger age groups. We have had fatalities among persons who had underlying conditions and were not aware of them. Yet we do want to encourage everyone to ensure that they take all their personal precautions to reduce their risk of becoming infected, as the age at which you become infected is not a guarantee of survival. We do want to ensure that everyone continues to take all the necessary precautions, which include the hand hygiene, the physical separation, the avoiding work and gatherings when you are ill, the seeking medical care as necessary. All of that we've been emphasizing as the new normal, we really do need to continue to adhere to that. Moving on to the geographic distribution, we've displayed the information a little differently today. And what we're showing is three sets of colors, really. We're showing the counties and the communities in which we have seen cases across the last 2 weeks. So instead of showing the cumulative, that's all of the cases from the start of the epidemic to now, we're now just showing sort of more recent activity, and we're displaying it by community. And you're seeing where the colors, the darker colors, indicate larger numbers of cases, lighter colors, fewer numbers of cases, the lightest color, 0 cases. So there have been some communities with no new cases within the past couple of weeks, but we do see the distribution of the darker colors throughout the country, so that there are no complete pockets of no cases in an entire county, but there have been communities with less activity. And while we note that, we do want to ensure that everyone in every community continues to take the necessary precautions. So we're going to display the information a little differently going forward, showing more of the recent activity and the geographic distribution. And we're hoping that we can drive some additional interest in maintaining your zero case status, if that's where you are, or reducing the number of cases within the community as we move forward. So this is part of the information sharing that we're hoping to encourage improved compliance, improved behavior, improved outcomes. Moving on, we've finished with the slides, and I will now turn you back over to Mr. Alexander.
Thank you, Dr. Hines. Dr. Othello will now explain the term COVID fatigue and offer advice on how you can convince your loved ones to stay safe, particularly during this Christmas season.
Good morning, Trinidad and Tobago. So we're talking about COVID fatigue again. I know we spoke about this topic a few weeks ago, but it's really important that we talk about it again because we're getting into the Christmas season, and this is a season that most of us normally enjoy, most of us look forward to it, and there are things we generally love to do that we're not going to be able to do the same way this year, or in some cases we're not going to be able to do them at all. So I'm going to share with you some tips that I really hope will help you to stay safe and to still enjoy the Christmas season. Under normal circumstances, without a pandemic or without any national emergency or global crisis, Christmas could be a very difficult time for some persons, and we have to keep that in mind. There are persons who lose a loved one during the course of the year, and this would be their first Christmas without that person. This year that's magnified because we also have persons who've lost their lives due to COVID, and these families are grieving at this time, and Christmas will be a difficult one for them. We also have to remember that there are lots of persons whose ability to earn was impacted by COVID, and they may not be able to afford the things they normally afford at Christmas time, or to be able to enjoy some of the Christmas festivities they normally like. And those people are going through a difficult time right now, and will go through a difficult time, and they need our help, they need our encouragement, they need our support. So how can we navigate this season successfully? How can we remain both physically and mentally safe? As I thought about that question, two keywords came to mind: focus and creativity. Why focus? I thought about the word focus because how we think about something tends to affect how we approach it and how we experience it. So in other words, if we think about Christmas in terms of what we can't do, what we wouldn't have, what we cannot enjoy this year, we go into it up front from a negative, pessimistic point of view, and we're more likely to not do well, and to, if depending on how you manage things, to not turn out too well at the end of it. So, however, if we look at difficulties as challenges to be overcome instead of obstacles that will overwhelm us, we could start to think about how we're going to overcome these challenges and come up with some strategies. So I want us to think about it from that point of view. This is a challenge, and we have to overcome it. We have to think about why we're doing this. Why are we giving up things we normally enjoy? Because that's never easy. It's never easy to give up things that you like. And we have to be focused on the fact that we're doing this so that next year, if all goes well, we will still be here to enjoy Christmas, and our loved ones will also still be here to enjoy Christmas. Another thing we can focus on is the meaning of Christmas. Christmas, I know, is a multicultural event in Trinidad, and Christians, of course, will be focusing on the religious and spiritual meaning, but at a wider level, we all think about Christmas as a time to share love and kindness and, express those emotions towards each other, a time for community, a time for sharing. And it's very important in the context of this Christmas that we maintain that, so that we remember that if we care about our community, we will do the things that keep members of our community safe. So it's not just about keeping me safe, It's about keeping my community safe, not just my elderly parents or grandparents, but my neighbors, my friends, their parents, their grandparents. If I care about the community, then I do the things that keep everyone in the community safe. Another thing we can focus on is, and it goes into the whole aspect of community again, is the fact that so many people are hurting right now. And sometimes when we take our minds off our personal challenges and focus on what other people are experiencing and what we can do to help them, it helps us. So let's think about maybe a child who can, would be cheered up by a toy or a gift, a family that is struggling at this time, and you may be able to assist them in some way. So think about how you could positively impact somebody's life this Christmas. You may have done it before, but give special attention to this year. And if possible, do a little more than you normally do, because we have a lot more hurting people this Christmas, and we can all do a little bit to brighten their lives. So that's the focus. What about the creativity aspect of it? Well, my recommendation is that, and it's not just my recommendation, I'm seeing it, being shared all over. We have to find creative ways to still enjoy the season. There are things we can do. We could have movie nights. We could have virtual games. I only recently discovered virtual Scrabble, and I almost didn't sleep the night I discovered it because I ended up playing for much too long. But, there are virtual games out there now that we can play. There are family activities that you could have with your immediate family that can keep you together, keep you enjoying each other's company, and keep you happy in spite of the fact that you can't go from house to house visiting in the way you normally would. From that, along those lines, there's so many things that you can do, and it's important that you talk to your family, talk to your loved ones, and among yourselves come up with creative things. For sometimes what works for one family doesn't necessarily work for another family. So have that conversation. Think about how you as a family are going to approach Christmas this year. Just how a few weeks ago we heard in the American political system, plan your vote. I want us to plan our Christmas, plan what we're going to do, so that it doesn't just overwhelm us when the time comes that you're not doing something you would normally have been doing, because you've already planned what you would be doing instead of that. So are we going to have a Zoom get-together with relatives abroad? And that's where we start to, tap into the so-called COVID blessings, because maybe normally Christmas time it would be just certain people you would see, but now you could widen that circle using electronic media and incorporating other relatives that you probably have not seen for several Christmases because they live abroad and are in different circumstances. So we can, find those creative ways to do things that keep us happy, keep us engaged, keep us enjoying each other, enjoying time together, and allow us to enjoy Christmas even though we can't do some of the things. So we may not be able to have the office party, we may not be able to have the staff lime, children aren't going to be sitting on Santa's knee in a mall this year, but maybe, I don't know, maybe we could have plexiglass screens surrounding Santa so that children could still see that visual of Santa and, get cheered up in that way. Think creatively so that at every level. Talking about children, I want to encourage parents to do what you can to keep Christmas as normal as possible. Children have lost a lot of the things they're used to, and they're adjusting. And in order to help them to continue to adjust, try as much as possible to do the things that they normally enjoy, but do them safely. Okay? They can help do things at home instead of going out. They can help you with your baking. They can help you do, butter the pans or, things like that. That's not too difficult, age appropriate. They can help with decorations, so they feel a part of the whole experience, so that they're not sitting there after school closes thinking about what they would like to do that they cannot be doing. Fill that time with things that they can enjoy so that they would still be happy throughout the season. So those are my tips for a happy Christmas. Focus and be creative. And in closing, let us all remember that COVID-19 is certainly not the gift that we want to give this Christmas. Thank you.
Thank you, Dr. Othello, for quite a comprehensive list of advice that you've given to us. We now go to Dr. Hutchinson.
Good morning to members of the head table and the viewing and listening public. My task is to talk about the services that are being provided by the North Central Regional Health Authority in the context of the COVID-19 pandemic and the strategies that we have developed to help the citizens of this country deal with the pandemic in terms of their mental health. The North Central Regional Health Authority serves a catchment that goes from Couva in the south to Arima in the east, and therefore serves the 3 hospitals that have been recruited to serve in managing the patients who've been affected by COVID-19. These hospitals are Couva, Cora, and Arima. And as a result, the mental health services that we provide in the region have had to be adapted to treat with this population. The mental health services at the North Central Regional Health Authority comprise 3 services primarily. There's an inpatient unit, 18 beds, that is situated at the Eric Williams Medical Sciences Complex, and 2 outpatient clinics that also are located at the Eric Williams Medical Sciences Complex, and a stress relief center that's located in Shogunas. That is a drop-in, psychologically led counseling psychotherapy service with backup psychiatric support. What we've done is adapted that latter service, the stress relief center, to serve the COVID-19 demands that have arisen out of the pandemic. There are 4 subpopulations that we have developed interventions for. One, of course, would be the patients who have been diagnosed as COVID positive and have had to be hospitalized. Secondly, are their relatives. Thirdly, the staff, the healthcare workers who are the front line of managing these patients. And fourthly, the general population. Although the services I described are in the North Central Regional Health Authority catchment, we do treat and serve patients from all over the country. With regard to the COVID-19 patients, the primary problem that we've had to manage is depression and anxiety coming out of being hospitalized for the condition. In some instances, we've had patients who've developed a confusional syndrome and have also developed some brief psychotic symptoms. These patients have been managed with a combination of medication and psychological intervention. In addition, some patients have struggled with being in quarantine and having to cope with the boredom and loneliness of being hospitalized and isolated from their loved ones. We've provided therapeutic support for this group. With regard to the relatives, the major issue that has arisen has been concern over their family members who are hospitalized, and in the instances where patients have died, to provide bereavement and grief support for these relatives. The major issue here has been information, providing information to them about the progress of their relatives, and of course preparing them either for discharge or for managing issues when the patients return home in the post-COVID state. With regard to the healthcare workers, The major issues that have arisen there have been related to stigma and burnout. The healthcare workers and the frontline workers have been subject to quite profound stigma from the general population, while there also has been appreciation of their work. I think fear over the COVID-19 virus has also led them, even at the family level, to be subject to stigmatization, and in some instances having to move out of their homes in order to continue providing care for COVID-19 patients. What we've attempted to do here is engage in both prevention and intervention. We've gone out to all areas of staff who are encountering COVID-19 patients in whatever way, from transport to stores to indeed, of course, doctors and nurses. And we've provided group sessions and individual sessions where necessary to help them manage the challenges that have arisen. In addition, COVID-19 burnout, them coping with the stress of managing these patients over time, and in a situation where the demands that are placed on them, both physically and psychosocially, are quite profound, has also emerged as a major issue. Again, we've attempted to provide support for this group by providing group and individual psychological services, and where necessary, psychiatric services. The Health Authority has also developed plans to engage in active relaxation and group activities that will serve to help the staff relax in the context of managing with the pandemic. With regard to the general population, the Stress Relief Center serves primarily the catchment area in Chaguanas, but has now expanded to serve the East-West corridor, and we have opened a clinic service at the Women's Center at the Mount Hope Women's Hospital on Thursdays. Over the course of the pandemic, we've seen an increase in demand for these services by 30 to 40%, and the greatest issue here has been the challenge with managing uncertainty and managing the stresses that have arisen out of the measures that have been introduced to deal with the pandemic, specifically the lockdown measures, again, issues related to social isolation, childcare, and the financial and socio-economic issues that have developed and emerged during this time. In addition, issues related to intimate partner violence, also known as domestic violence, issues related to child care, and the pathology associated with children and adolescents who are now not in school and spending some unsupervised time at home, have also proved to be significant stressors that have had to be managed. The uncertainty about the future and the issues arising out of fear related to the pandemic, I think, have released some individual and social fault lines that may have existed prior to the pandemic, but have now become more prominent and more challenging to deal with. So in attempting to manage these, we've had to engage in interventions that support the family, support the social network within which people function, and also attempt to encourage everyone to engage in activities that are focused on self-care and self-efficacy. These activities primarily center around the basic healthcare activities such as a healthy and consistent diet, getting regular exercise, even if it is at home, and engaging in techniques such as meditation, yoga, and spirituality, if you're so inclined, to manage the psychological difficulties associated with the COVID-19 pandemic. The challenge of managing the several measures that have been instituted remains one that has to be overcome, but what we have seen is quite significant resilience in the population to manage these, as well as a willingness to seek help. And at the North Central Regional Health Authority, we are keen to encourage and facilitate this and have additional plans to reach out into the community to further support these initiatives. Finally, we are in the position where our support staff, meaning those that are providing mental health care themselves, are receiving a lot of pressure, and therefore they too have to be supported. And we've also developed a system that can provide support for the mental health care workers. So thus far, I think our success has been that there have been not very many major events related to the pandemic. We've had one suicide, we've had some significant self-harm, and we've been able to manage the psychiatric patients who have developed COVID-19 to a fair degree of success and have ensured that their psychiatric care is maintained. In closing, I'd like to say that we must continue to take care of our mental health, engage in self-care, engage in monitoring our mental and emotional responses to the pandemic, strengthen our social and family networks, and remember that there is no health without mental health. Thank you.
Thank you, Dr. Hutchinson, for a very insightful presentation. Next on the agenda is the question and answer segment. We once again remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please ask both questions, one right after the other, to the relevant members of the panel. If time permits, we will facilitate a second round of questions, 1 question per media house. Today, we begin the Q&A with questions from Newsday.
Good morning all, Shane Superville from the Newsday newspaper here. I have 2 really quick questions, both of them for Dr. Avery Hines, and it has to do with the state of the prison and correctional facilities in TNT. The first question is from an epidemiological standpoint. Can you just give us a quick idea or a snapshot of what measures are in place behind bars to control the spread of the virus? And secondly, based on your own understanding and experience, do you think these measures are enough? And if not, what can we do to strengthen it?
Okay, thank you for the question. Now, the measures being put in place from the prison side of things are actually measures that are orchestrated and implemented by the prison medical personnel, and there is technical guidance that is provided by the Ministry of Health. Those measures would follow the general principles of identification of those who would have been exposed, of isolation of those who may have been exposed where it is possible, quarantine of the groups of exposed individuals is in such a manner as to prevent them from exposing additional personnel. And to the best of my knowledge, a lot of those steps have already been taken. What you are seeing would then just be the results of pre-existing exposure now manifesting in those exposed individuals. You need to bear in mind that given the repeated advice that we've given the general public, that the measures that we need to take as a population include things like the hygiene, physical distancing, etc., that the extent to which this is possible within the prison system would then improve whatever outcomes they have. But the attempts to improve the risk reduction, to the best of my knowledge, have followed the guidelines and the guidance provided by the Ministry of Health technical personnel to those technical personnel of the prisons. Mr. Alexander.
Thank you, Dr. Hines. We now go to AZP News.
Hi, good morning. Prior Bihari, AZPnews.com. My question, just to follow up on Shane's question to Dr. Hines. Dr. Hines, you said that there are 108 people in the prison system who are currently under quarantine. On last week, on Saturday, the CMO said there were 84, and the press releases that were sent out to the Ministry of Health on Friday said 66, then Saturday 14, and on Sunday 108. Can you just explain to me these figures, exactly how many people are actually infected and over what period of time these numbers change? And are they both prisoners and prison officers, and are they being held in the same place? Thank you.
Okay, thank you for the question. I think what we need to clarify is that what's put out in the press releases actually indicates, out of the current group of positives, what number belonged to the prison system. So each number that you would have seen and that you would have just itemized would be the number out of the total positives on that day that would have belonged to the prison system. So today, for example, out of the 126, 108 were tests that came out of that prison system. So it's not that the number that is given each day is the total number of positives within the system. There are, I think, somewhere in the vicinity of over 200 individuals who would have been exposed and who would be monitored throughout this time period, and the time period would extend back a couple of weeks. So the first of the cases would have occurred at least 2 weeks ago, and the monitoring really now follows those who would have been exposed either primarily or secondarily. So the time frame is at least 2 weeks, quite possibly another week just in advance of that, and the total scope exceeds 200 people. We will see the final numbering when we actually get all the follow-up testing completed, and that information is then reported to us. The combination of individuals, that's not information I have at my disposal at this point in time, so I don't have that in front of me, but we would expect that if there is close interaction between both the inmate population and the population of officers, that there can possibly be both sets of individuals infected. With regard to if they're being held in the same place, the officers wouldn't be held. So I'm assuming that wasn't what you asked. If you get the chance to clarify that in the follow-up questions, please do.
Thank you, Dr. Hines. We now go to CNC3.
Morning, everyone. Rashad Khan, Guardian Media Limited. Dr. Hines, over the weekend, there were two events that caught the public's attention. One was a police raid on an underground party in Caroni, and one was a wedding that was held in Valsayn where it happened, right? From your perspective and from an epidemiological standpoint, does these two situations have any difference in its risk to spreading COVID-19? And the second question I have is to Dr. Hutchinson. You made mention about there was one suicide and you attributed it to probably pandemic stress. Could you just expound on that a little bit more for me, please? Thank you.
So thank you for the question. It's an excellent one. There is no distinction between one type of gathering and another with regard to the COVID-19 risk. The virus does not discriminate between one setting and another if protocols are not followed to prevent the transmission of illness. Those protocols including the reduction of gatherings to below 10, the physical spacing, the avoidance of gatherings when you're ill. In whichever setting those occur, that will present an epidemiologic risk of transmission, irrespective of where that particular event would have occurred. So yes, any kind of gathering, either past or future, will present that additional risk. And it is for this reason that the Prime Minister, for example, would have indicated the request for office gatherings and those sorts of normal Christmas events to be foregone as a step in the direction of reducing the bringing of different webs into contact. This is something that we keep emphasizing from an epidemiologic point of view. If you, as a family member, go out to work, you have exposed your family to whatever exposure there is at work that you come back home with. everyone exposes their own individual webs and brings exposures from their family webs to whichever workplace or whichever gathering place they find themselves in. So the extent to which we can reduce the intersection of separate webs, separate social webs, is the extent to which we can slow the transmission of the virus. And the reduction in these gatherings we do like to have, especially as the Christmas season rolls forward, is going to be an essential component of reducing the risk of a surge in cases throughout the holiday season. So thank you for the question. I turn you over to Professor Hutchinson.
Yes, that reference to the individual who committed suicide was in fact a patient who had been diagnosed with COVID-19 and who had been admitted to the new Arima hospital, and in being unable to cope with the diagnosis had jumped from the third floor at that hospital. We've also seen people who, in fearing that they had contracted COVID-19, have engaged in attempted suicide and have had to be admitted to hospital for this reason, particularly among the elderly population. But in terms of suicide, the reference was to that case that occurred at the Arima Hospital.
Thank you, Dr. Hutchinson. We now go to TV6.
Hi, good morning. Alicia Boucher from TV6 here. I have two questions. The first one is to Dr. Hines. From an epidemiological perspective, do you think, like, those, because of the high risk that we would have seen in those two events over the weekend, do you think that we perhaps need to add some measure of quarantine to persons found in such surroundings, given that if you have 250 persons on one end in a party, that some of them can be possibly positive with COVID-19? That's the first question. The second question is to Professor Hutchinson. You mentioned persons who fear they have COVID, as well as persons who have had COVID becoming suicidal. Do we know whether or not among the entire population, whether the amount of suicidal attempts have increased and whether the suicide rate has increased? And in addition, the facilities that we do we have enough capacity to treat with persons who may need in-house care at this time?
Okay, thank you for the question, Ms. Boucher. The quarantine of an individual or a group is a legal process that is initiated by identification of specific risk of exposure. Now, this is different from identification of potential risk of exposure because of where a person may or may not have been. We cannot implement or initiate quarantine just based on an individual's location in a gathering or not. What would happen is if there are positive tests that are related to or traced back to that gathering or any other gathering or any other situation, that contact tracing is what identifies which individuals would have been exposed and therefore need to be quarantined. We don't have preemptive quarantine just on the basis of having been in one place or another, because then we need to quarantine everyone. We go to work, we take taxis, and at any point, anyone could have been exposed. We can't go on could have. We need to work with an actual confirmed case that we then trace back to a given exposure setting. So I hope that answers the question. I turn you over to Prof. Hutchinson.
Thank you for the question. In terms of rates, I think the difficulty is that for attempted suicide, the only measure we have is people coming to hospital. And because of the pandemic, what we saw certainly in the initial period of the pandemic, reduction in admissions, primarily we speculate because people did not want to be exposed to the possibility of being around people who might have COVID. So if we were purely to go by hospital admission, rates, I would say that we have not seen an increase. Neither have we seen an increase, certainly in terms of reports to us regarding suicide, but in many instances, the suicidal response lags some months behind the exposure to stressors. So I think that it is something we're monitoring, and a more accurate answer to that question would probably come early in 2021, when the cumulative effects of the pandemic and the measures that have been instituted to manage it might have the effect on people who are vulnerable to suicide. With regard to capacity, thus far we've been able to manage, and I expect that we will be able to. I think that certainly at the Eric Williams Medical Sciences Complex, we have the capacity to manage whatever influx of patients we've had with suicidal ideation or attempts, and indeed mental health problems. But it's one of the reasons that we've engaged or attempted to engage in preventive and outreach work in order to anticipate this and provide interventions early in the progress of the potentially negative reactions to the stresses related to the pandemic, and provide mental health support in order to prevent it deteriorating to the point where it might end in either a suicidal attempt or suicide.
Thank you, Professor Hutchinson. We now go to The Express.
Good morning, Tim Mojam from The Express. Dr. Hines, just to go back to the prison testing issue, so I hope I didn't miss anything and I'm asking you to repeat yourself. But the Prison Officers Association president, Mr. Seren Richards, he actually put it out there today that everyone in the prison, everyone associated with the prison at this point should be tested. Everyone who could be found to be associated with someone in the prison should be tested, because it's a sort of time bomb event. I mean, is that feasible? Could you address that in any form? And is it feasible? How would the Ministry of Health, if it were to pick up such a call, go about that? Do you agree with a call such as that? And then going back to the spiking cases as well, we're seeing a few places around the world are going back into lockdown, in and out of lockdown. And so is that a pattern we could expect to go into towards Christmas? I guess is what I would want to ask. I know there's no way for you to predict that, Dr. Hines, but can you give us an idea of the pattern we could be facing? What are the health authorities recommending going forward to prevent this pattern? I know there are guidelines in place, mandatory, but how can we start to put a stop to this? Thanks.
Okay, thank you for the question. Now, as I mentioned before, the identification of who should be quarantined, who should be tested, will be a process that is driven by the information generated in the contact tracing process. That contact tracing process within a captive situation, pun intended, is one that is going to be a little more robust, because we have a much clearer idea of who would have been in contact with whom at what point in time. So while it may not be necessary to broadly test across the entire population of the prison, both officer and inmate system, it is possible to identify those who would have been in contact via the questions that the contact tracers would be asking, and that process will identify who needs to be quarantined, followed up, tested, etc., as opposed to the blanket approach. Now, your second question is quite interesting, because you both asked and answered it, I think. You asked, what can we do to get people to adhere to the guidelines, which are the process by which we want to reduce the risk of a spike going into Christmas. All you can do is to get people to understand that their behavior is going to drive what happens next. The population, both as a collective and as a group of individuals, needs to understand that our behaviors going forward, every decision we take about where we go, whether we gather, whether we go into a crowd with milder symptoms that we think may not be corona. We don't know whether we present ourselves at work when we're ill, whether we follow the quarantine orders when they are given. Each decision is going to drive either an increased or a decreased risk of transmission between one individual and another. And that's how this virus works. That's how epidemics work. Each individual choice then sparks a new web of either risk or risk reduction. So the only way we can get ahead of and stay ahead of a potential surge is to have the vast majority of the population actually adherent to all of the guidelines. The hand sanitization, the physical distancing, the mask wearing, wearing the masks properly. Your nose outside the mask is basically pointless. That means you're not wearing a mask because you're not covering the droplets that are going to be expelled from your respiratory system. We all need to do this, and we all need to continue to do it, and we can't do it from the perspective of, well, I'm waiting for this to go back to normal. This is not the mindset that we need to have at this point. We really need to have the mindset that our precautions are the new normal. We're not trying to go back to a different state. We're trying to maintain the prevention of transmission. So there is nothing beyond the continued exhortations, the continued requests that we're making that we can do to get additional compliance. And as you rightly noted, if we don't get that additional compliance, then the risk is that the number of cases within the population can again begin to rise. And we are hoping that that's not what will be happening going towards the Christmas season, but we are going to continue monitoring and continue to keep the population, the public, updated as the information comes to us.
Thank you, Dr. Hines. We now go to CL Communications. CL Communications. Okay, we'll get back to CL Communications, so we move to AZP News.
Hi, good morning again. Yes, Dr. Hines, just to clarify the numbers in the prison system who are COVID positive. The CMO had said on Saturday there were 84, and I think you are saying now 126. So is it that there are now 42 new cases, positive cases in the prison system right now? And can you tell me if you think that maybe these cases might increase? Thank you.
Okay, Mr. Bihari, as I noted, the individual updates stating how many persons are from the prison system among the positives that you get on a given day is what you're referring to. So it would not be that between the 84 and the now 126, that difference is what you're counting. We have added 126 positive cases, and out of those 126 positive cases, we've noted that 108 were from the prison system. So if we look back more carefully at the actual documentation of the release, I think a better understanding would be had of what figures had been produced. The second question regarding whether we think that this may increase, we will have to wait and see. We know that some precautionary measures had been put in place to isolate and to quarantine, isolate those who were known to be positive, quarantine those who were known to have been exposed. And while there may be unknown or undocumented exposures that may lead to additional positives, we're hoping that the implementation of these measures will slow the spread throughout the remaining currently unaffected prison population of both inmates and officers.
Thank you, Dr. Hines. We go back to CL Communications. Are they ready? Okay, so we go to... Yes?
Vivian Bowen, Caribbean Lifestyle Communications. Dr. Hines, of the 100 new cases from the prison system, I would just like to confirm that none came from the female prison. And if there is none, what is being put in place to mitigate the spread in the female prison, considering that the female prison population doesn't have the overpopulation factor as the male prison? Thank you.
Okay, to the best of my knowledge, I don't believe that any did come from the female prison. We can't verify that. But the question that you then asked and answered, I think, is relevant. again, the same measure, the same mechanisms to reduce the potential contact between ill and not ill people would be put in place preemptively in all of the protective services remand facilities. And those measures would include asking people not to come to the facility if they are unwell, monitoring of symptoms of people who are unwell, and monitoring of the population within the prison on an ongoing basis to verify that no one is developing suspicious symptoms. So all of those things would be basic measures that would be put in place, and if there is the greater capacity to implement physical distancing because there are fewer people per square area, then that's an advantage. So yes, that lack of crowding in the female versus the male prison may present an advantage and an additional opportunity to reduce the risk of spread.
Thank you. We will take a question from CNC3.
Hi, morning again. Dr. Hines, tell me really quickly, are you all at the Ministry of Health concerned that people are using this loophole between private versus public spaces to kind of get around and have these large gatherings? And are you especially concerned that the incident over the weekend is going to set a precedent to encourage people to continue into the Christmas season?
So the general concern remains that if any group of individuals in any space, public or private, chooses to gather in numbers that exceed the recommendations, continues to have events or to have gatherings or to have situations where people are not physically distancing, where there are more people than there should be in a given space, where people aren't wearing masks because of whichever activity they're engaged in, all of these factors are concerns that we have repeatedly attempted to voice to the population. We need everyone, everywhere, public space, private space, to understand their role in preventing a massive surge of cases as we move towards the end of the year. We know that there is the desire to congregate. We know that there is the desire to see friends, to mingle the way we would usually have done in the past for the Christmas season. And because of this, we keep emphasizing the need to adhere to the new normal, to reduce the risk of transmission by eliminating several of those gathering settings. So we do hope that good sense prevails, that the understanding of the risk that any gathering would pose is being better grasped by the population. We need to ensure that we all see our individual rules and our collective rules as groups, as companies, as persons wanting to have a gathering, see our individual rules in reducing population risk and personal risk and risk to our family members. Because at the end of the day, beyond your own individual risk of contracting coronavirus, there is the risk that you pose to your family members, the persons within your household, your elderly family members who you may visit from time to time, and that risk is one that we hope will drive a greater consideration of risk reduction, even if you don't do it for yourself or on your own behalf. You'd want to protect your kids, you'd want to protect your elderly relatives, you'd want to protect those around you who may get more ill than you think you will get, and also to remind you that you don't know how ill you will get yourself. So we'd rather not play Corona roulette. This is not the time to play this game. This is the time to try to reduce risk to the greatest extent possible. So thank you for the opportunity to re-emphasize that.
Thank you. We can take a quick question from the Express. Express?
Thanks, Captain. Morning again. Kim Bojram again. For either of the mental health experts, there's a huge amount of pressure overall being put on everybody for all kinds of things. Do either of you have a concern that, you know, the perception of some people being treated differently, Zessa party versus some other event where the people, you know, there's a perception that the people may not have been dealt with in the same way as the Zessa party. And so these are added things in the pot. I mean, is there a concern that that type of perception is, you know, fueling more malcontent in the country, bad feelings, just overall causing things we don't really need at this point, with the added pressures of the pandemic, which is exaggerating a lot of things, you know, the education issue, access to things like that, access basically to certain standards of living. Thanks.
Oh, you said either of the professionals. I think I'll give Professor Hutchinson a little rest since he's been taking all the mental health questions. At this time, yes, we are aware that there are a number of stressors, and that's why we keep doing this from time to time, speaking to the public, bringing in different mental health professionals to talk to you so that we can try to address the mental health challenges. The mental health impact of COVID is not a Trinidad thing or a Tobago thing or a Caribbean thing. It's a global thing. And it's real, and we're experiencing it just as every other country is. And whatever the social issues that prevail in that country happen to be at that time, yes, they are likely to impact. And that's why earlier on I said, let's focus, because how we look at things affects how we respond to them. So that my best advice is that we pull back from getting too drawn into the controversy. Yes, I know media personnel has a role with respect to questioning and challenging and getting the information out to the public. But even while we're doing that, to everyone, not just media, but to everyone, let us not be too focused on the controversy aspect. Let us be focused on the solution aspect, and let's all be a part of that solution. So as Dr. Hines said, let each one of us play our part, remembering, well, he called it, I think, Corona Roulette. I spoke about it not being the gift you want to give.
Thank you very much, Dr. Othello. We have come to the end of today's media conference. Thank you, everyone, for your participation. As we celebrate the Christmas season, please protect yourself and your loved ones. Remember to adhere to the simple guidelines that we at the Ministry of Health continue to reinforce. Wash or sanitize your hands and clean frequently touched surfaces. Maintain at least 6 feet physical distance from others. And I am confident that COVID-19 is a fight that together we can win by ensuring we also use a mask to cover our nose, mouth, and chin.